Welcome, everyone. Thank you so much for joining us today. I'm Mary Price. I'm the Events and Marketing Director at the Scholz Institute at Utah State University. Today, we have Carlos Scholz with us. He is the CEO of Catalysis and a member of the Scholz Executive Advisory Board. In our newsletter earlier this month, we published an article called Leading Through Healthcare Disruption, which is the topic we're discussing today. And you can read that article by going to shingo.org/articles. Carlos, thank you so much for taking time to share with us today, and I'll turn the time over to you.
Thank you very much, Mary. It's a pleasure and a privilege to be here. And I'm a great friend of the Scholz Institute and everybody at the Scholz Institute, and really appreciative to be a part of that organization and being in the board. Today, I'm here to talk about a topic that I'm really passionate about. It's about leading through a significant amount of disruption that is happening through especially healthcare, but it could really happen in any kind of industry. And hopefully this will add a lot of value and it will enable some conversation. First and foremost, I wanted to tell you a little bit about my organization, Catalysis, who partners a lot with the Scholz Institute. We are an independent 501c3 non-for-profit education institute. It was founded, many of you know, by Dr. John Toussaint about 15 years ago. And the vision that it was founded upon, and we continue today, is to continue to transform healthcare to deliver higher value. Our healthcare system continues to be broken and botched and difficult to navigate. And our hope and our vision is to continue to deliver healthcare transformation, especially through experiments and collaboration and education. And we hope to continue to do that and to accelerate improvement in the healthcare world, especially by applying the principles of organizational excellence that the Scholz Institute teaches. What we offer is a series of workshops and on-demand learning and customized learning, and we collaborate with the Scholz Institute and other organizations on conferences. We do have a network membership model as well, where by being a member of our network, you can get a lot of benefits. We offer executive coaching and other things. So with that, I just wanted to provide that initial context about Catalysis and who we are. And now let's get to topic. Disruption is nothing new in healthcare. I can tell you that I worked in healthcare for about 15 years now, and in those 15 years, I have observed a significant amount of transformation. And part of that transformation occurred when, for example, the ACA became effective into law, and that provided access to healthcare to millions and millions of people. The upcoming and the upbringing of newer and more modern electronic health records has caused a significant amount of disruption as to how care is delivered, how physicians work, how staff like nurses and medical assistants work, how do you access your care, your records, etc. It's a significant amount of transformation in the industry, and disruption isn't new for any of us. But this last year has been really interesting in healthcare, and I think it will cause that disruption to really increase. The One Big Beautiful Bill Act that this current administration passed into law last summer in July, it's on a whole new level of disruption in healthcare. Just to give you a few ideas about what that disruption is going to be, it will impact patient care and quality. Why? Because there's going to be a lot of cuts into specifically the federal programs that help pay for a big portion of how healthcare is delivered in this country, in the United States. There's going to be close to $1 trillion in cuts over the next 10 years, which will catapult a series of issues and changes that we are expecting to happen over that period of time. And some of them will be accelerated over the next year as some of the portions of the bill pass, like reduced long-term care. One of the biggest part of Medicaid especially is paying for long-term care. Medicaid is one of the biggest payers for long-term care in the country, and as Medicaid gets cut, we do expect to see a lot of changes in how long-term care is delivered or possibly even cut. We do expect declining quality and preventive care delays. Why preventive care delays? Well, because a lot of people are going to lose coverage and they're going to delay their care more likely than not. And specifically, what gets delayed first is preventive care. There's going to be further financial strain on hospitals that are currently strained and have very little to no operating margin. And there's going to be an expectation on about 19 to 50% reduction in the operating margins in a lot of organizations. The organizations going to be impacted the most are safety net hospitals. Why? Because they are the ones that depend the most on Medicaid. So with that, choices are going to have to be made. Facility closures, maybe some service are going to have to be. There's going to be some financial strain on hospitals. There's going to be an expectation of a reduction of operating margin. I've actually been talking to some hospital CEOs, and they have told me that they're expecting to lose from Medicaid anywhere between $100 to $150 million a year in revenue from Medicaid over the next year alone. Which is a significant amount of their budget. So with that, they're going to have to decide around facility closures, possibly some service cuts. And this is going to completely redefine how care is delivered. There's also an expectation for increased administrative burden. This new bill requires a significant amount of administrative churn due to new eligibility requirements, and organizations are going to have to bake that into their processes to ensure that the patients meet those criteria. And again, it's a significant amount of non-value added work at the end of the day. And again, it's going to impact beneficiaries and insured people. So a lot of people are also going to see increases in their premiums. Some of them are already seeing that. There's going to be potentially loss of coverage for millions of people. At the end of the day, from a supply and demand perspective, this is a part of the game as well. Because a lot of these changes are happening, and over time, there's been a significant amount of overburden with physicians, and the system rewards providers that do more procedures rather than just primary care physicians, for example, that don't do procedures. There's going to be an expectation of a shortage of about 40,000 primary care providers. So access to primary care is also going to continue to be strained. With that, my take on all of this disruption is, well, it's nothing new, and it's nothing that we did not expect. It was not going to happen. The whole supply-demand issue will completely have to redefine how healthcare is delivered. It will require the use of some level of technology, but systems that focus only the efficiencies, how can we continue to eliminate waste, or are actively only chasing the outcome, will suffer at the end of the day. While those that build the engine that drive sustainable and reliable outcomes will find a way to pull ahead. I see this analogy kind of like having a car. And when you open the hood of the car, you notice that there's a lot of problems and a lot of defects. You can choose to be an organization. You know what? I need to just go another 100 miles. So I'm just going to do a patch here and a patch there. And the car will go on 100 miles. And then you'll patch it again and it will go another 80 or 70 miles and on and on and on until the car just won't go. And I have seen more than enough organizations in healthcare that are currently in that phase, about to find out where the car will continue to go or not any further. Or you could be the organization that says, you know what, we need to completely rebuild the engine that is going to reliably and consistently and sustainably take us for the next 10,000, 20,000, 100,000 miles along the way. And those kinds of organizations are the ones that are going to pull ahead in this new disruptive world in healthcare. There's also a lot of technology that is disrupting healthcare, especially AI. Pretty much almost every CEO in healthcare is relying on AI or some version of AI. That alone won't be enough to find efficiencies. There are things that AI will be able to find efficiencies for, and things that is not going to replace. And one of those things is leadership. And this is a test of leadership for a lot of organizations. And AI is not going to help, redefine that leadership. So there needs to be also a redesign of a lot of the ways in which care is delivered, care models, how patients flow, workflows, compliance, reporting, and all of that will require an accelerated pace of design or redesign. But the most important thing that I do believe organizations need to focus on is building the culture and the systems that are anchored on principles. This is no longer an option in my view. Principles that are deeply rooted in proven organizational excellence. I don't need to do, I guess, any type of convincing for this audience that is joining us today about why these principles matter, why they work, why when you are consistently applying them, when you live them through your leadership, when you deliberately practice and they become truly the fabric of your organization and part of the DNA of who you are, what you do, how you lead, how do you show up as a leader every single day in your organization, things really start happening in a much more reliable and sustainable way. So we're going to explore how I believe the application of these principles over the next few years in healthcare organizations are going to truly enable reliable and sustainable outcomes. But it's about building that engine, not just patching the engine. The first, and I think the most important one, is enabling the right culture. This disruption will create a lot of turnover. We're already seeing it. There's a lot of fear. There's a lot of burnout. Nothing new in healthcare. Your ability to retain and engage and align and motivate people and grow them within the organization, even in challenging times, will define how much your organization is going to be able to be resilient, even in the harshest of times. How I believe this will happen? Well, I believe in the principles of respect for people and leading with humility. And I believe that leaders need to align behaviors with performance at all levels of the organization. But it starts with them. This is not something that, in my perspective, should start closer to what value is added. I think this is something that has to start with the top leaders of the organizations. It's about how their leaders stand the work shows up in a simple and consistent way every single day. It's about the application of routines that keep leaders connected to the work at the Gemba. They support through coaching. They develop people and processes. This is the role of leaders in the organization, to create the environment in which people can solve their own problems and create the right level of capability, because the more capability an organization builds, the fastest they're going to adapt to any kind of scenario or condition in the market. They need to cultivate a culture of experimentation and learning and curiosity and model that coaching and that curiosity on a day-to-day basis. They need to advise less. They need to give less answers and ask more and create the psychological safety that allows that to happen in any level of the organization. I think the other key that I do see is this is not by any stretch of imagination easy work. Dealing with cultural change and behaviors is not in any way easy. But the more you focus on relentlessly maturing the system so that it helps drive those behaviors, the more success you will see over time. The more that the system matures, the more people develop through it, not just to perform, but to grow through the organization as well. This doesn't happen overnight. And it doesn't have to be that complicated. It's complex work, it's difficult work, but it doesn't have to be made difficult. It could start with very simple changes that happen every single day. Like, how do the first 30 minutes of my day need to look like? How different do I need to show up during those first 30 minutes of every single day? And you start with an experiment around that in a way that, how does that set me off for the day? How does that set my people off for the day? What experiments do I need to run around that? What am I going to do differently? Am I going to huddle with people? What type of questions do I need to ask? What do I need to know about how I need to support them during the day? And that it could really start with something as simple as that. Number two is alignment. To me, develop an aligned and agile organization, but with enough flexibility, will be critical. A structured and agile strategy deployment system is more than essential in these days. People at all levels of the organization need to clearly understand what matters, why does that matter, how does that translate to my day-to-day, and how do I contribute to the success of the organization? In which ways what I do as a nurse, as a medical assistant, as a physician, and every single interaction really helps drive that outcome that the organization is going after. So having a Hoshin-Kanri system to align strategy through all levels of the organization that maintains the focus on the critical few things, that creates a level of alignment, clarity, and people know what to do every single day is more than critical. And identifying and tracking the things that matter and how to measure those things that matter really is important. Just recently, as recent as 2 weeks ago, I was actually in the Gemba in an organization, and as I was going through different parts of the Gemba, from inpatient to outpatient to a lot of different areas, the emergency department, etc., I could see that lack of alignment. I could see that every department defined things that matter to them, but nothing that really at the end aligned to something concrete for the organization. All good efforts, but not really aligned through the organization. That's why the more an organization aligns, the more resilient and the more people will be engaged. And the most important things of alignment is linking those strategic needs for the organization to the everyday operations. People really need to know every day how they contribute and build the management system around those things. When they huddle, what did they talk about? When they go problem solve, what are they problem solving for? Those kinds of things matter, and they matter a lot. Number three is redesigning how care is delivered and how it's accessed. This is about the principle of improving flow and pool. Let's just be real. The projected coverage losses are going to really put a strain on a lot of system, and that could lead to increased emergency department visits or care delays, or having to cut some services, or having to think differently about how we deliver care. This is a great opportunity to redefine how care is delivered. A great example of this is Humans Memorial, one of our great partners for catalysis, is actually rethinking how care is delivered at home. Remote patient monitoring, for example, is one of the big bets that they're making. So they are really leveraging lean design methods such as rapid prototyping or co-designing something with a vendor, in value stream mapping, the patient journey, etc., in a way that through iterative testing and design, they're rebuilding their workflows around how remote patient monitoring is really becoming the future for them. And they're really leading the way and showing the way to others. This is an example of something that should be happening in your organizations now, not just rely on the same old systems that have existed, but to co-design those future states of how the continuum of care is going to be delivered. And I believe it's going to be critical to develop that level of capability in organizations to create and redesign those in a collaborative way. Number four is relentless continuous improvement. It's about the principles of seeking perfection and assuring quality at the source and embracing scientific thinking. And the new policies are going to highlight a lot of administrative burden and clinical burden in a lot of different ways. It will create more complexity. the focus of every organization has to be about reducing waste without cutting value. You cannot rely only on AI to do that. You cannot just say, I'm just going to purchase this, put it on, flip the switch button on, and expect that it's going to create the levels of efficiency that you are expecting. Organizations that rely blindly on predictive models for length of stay, for example, are quickly finding out that these models are not really producing the level of efficiency that they were expecting. So what you need to do is potentially pair that technology, but first focus on process mapping, identify where you need to eliminate waste, focus on first administrative or clinical workflows, apply standardized work, integrate visual management into it, and then you adapt the technological solution to all of those things in order to truly deliver. This is really about putting process and people first. Those that really know the work the best will better understand what needs to happen and when it needs to happen. Every patient is different, so they will be able to provide those nuances that the technology solution is not going to be able to deliver on or predict on, because it's limited in its thinking and in the way it processes the information. There's a lot more inference that is required in a lot of these models versus just pure statistical prediction. So again, relentless continuous improvement, you're going to have to rely on those people doing the work being heavily engaged in daily problem solving and using some of these tools that I'm referencing here. These are just a few examples. And the last is to integrate AI and technology through a lean lens. Yes, I do believe in AI and technology, and I do believe that they are going to create a significant amount of efficiency, but it's not going to happen if it's not done, from my perspective, through a lean lens, to really define a purpose-driven AI or business intelligence strategy that really enhances the human capability instead of replacing it. It really starts with process clarity. From my perspective, it's about mapping the processes. It's about eliminating the waste before inserting any technology and making it a core capability at the end of the day. It's not just buying the tool, putting it out there, flipping it on, and expect people to follow suit on a lot of that. It's actually quite overwhelming for staff and physicians to do it that way. But when they have the ability to bring their own ideas and solutions to it, you really learn a lot about how AI or any other technology really will be able to help in any case and for any patient. But you build the model in a way that it truly enhances human capability. So these are just a few examples. I'm not going to focus on what these leadership and behaviors are, but you're going to get a copy of the presentation, or you can just screenshot it now. This was developed by our great friend, Jake Raymer, with collaboration with other people. These are examples of what I refer to as the principles and behaviors that I believe are truly needed now more than ever in any organization that really wants to be resilient and flexible and adaptive to the current level of disruption that we're having in healthcare. This is really where the rubber's going to meet the road for a lot of organizations. This is truly a test of leadership for a lot of these organizations. Last but not least, I want to really invite all of you to our upcoming Shingo Connect event that is going to happen in San Diego in March 18 to 20. We are actually one of the collaborators of the Shingo Institute. We're very happy for the first year to be able to do that with them. I'm actually going to be delivering a keynote during that time that is going to focus exactly on the topic that I just spoke about today.
Perfect. Thank you so much, Carlos. We're really excited to have you come and speak at the conference this year. So thank you so much for your willingness to do that. It'll be great.